Coverage of the 28th annual meeting of the ASMBS is brought to you by Bariatric Advantage, the most complete line of micronutrient replacements specifically designed for the weight loss surgery patient. Click on this ad to order yours today.
Hi, this is Tony with BariatricTV, and I'm here with Dr. Jonathan Finks. Dr. Jonathan, you released a study here at the ASMBS meeting about depression before surgery. Can you tell us about that study?
Right. Well, I'd be happy to. So we actually looked at patients from the Michigan Bariatric Surgery Collaborative, which is a consortium of hospitals and surgeons that collects data on all the patients who undergo bariatric surgery in the state of Michigan. And we started in about 2006, and we have about 27,000 patients now in the database. And what we really were looking at was how prevalent was psychiatric disease among people who were going to undergo bariatric surgery. Mm-hmm. The other goal was to look at the influence of underlying psychiatric diseases on outcomes from bariatric surgery. So changes in quality of life, satisfaction with surgery, weight loss, and then complications with surgery. Mm-hmm. And finally, we wanted to look at, among people with depression, what happened to their use of antidepressant medication. That was sort of a proxy for, whether or not they improved in their depression.
Right. And the results of your study was?
So what we found was that overall, psychiatric disease was very prevalent among people undergoing bariatric surgery, particularly depression and anxiety. So overall, about 46% of people had some psychiatric disorder. 41% had depression, about 15% had anxiety. Bipolar disorder was seen in 2%, and then there was sort of a smattering of other things. Mm-hmm. So it was a very prevalent disease. We also found that people with a psychiatric disorder had a little bit higher rates of minor complications like wound infections. The proportion of people who said that they were very satisfied with surgery, which was the highest marks you could get, was a little bit lower in people with psychiatric disease versus those without. So it was a difference of 86% versus 82%, which isn't really a big difference. But otherwise, changes in quality of life overall, there was about a 30% change, improvement in quality of life with both of the different instruments that we used to measure that. Mm-hmm. And that was equivalent whether or not you had a psychiatric disease or not. Mm-hmm. And we also looked at 1 year weight loss, and it was about the same for the two groups. Mm-hmm. So overall, the results were very similar. Finally, what we looked at was the amount of people using antidepressant medication. So at baseline, in the baseline survey before they had surgery, about 72% of patients with depression were on an antidepressant.
Wow.
At 1 year, that had dropped to 60%. So that was about close to a 20% decline. And that actually remained stable over the 3 years that we have follow-up data for, which was quite impressive, and I think suggests that bariatric surgery may improve depression somewhat, although further study is definitely needed.
Patients have a tendency to take better care of themselves after weight loss surgery, so I'm wondering if that was taken into consideration with this as far as continuing to stay on meds instead of thinking that weight loss surgery was a cure-all for everything.
Yeah, well, that's a very interesting point. And really, our data comes from surveys that were given to patients prior to surgery and then at 1 year, 2 years, and 3 years. Mm-hmm. So really, they're just answering questions like, are you using an antidepressant medication, yes or no? So it's a little bit difficult to drill down on exactly the things you're pointing out, but those are very important points, and I think in a smaller study would be important things to look at. Really what we saw was that there was a decline in antidepressant medication use. And, does that mean that they no longer have depression? Not necessarily. It's possible they're doing other therapies. I think it suggests that there's some improvement. And other studies have actually shown that with weight loss, depression specifically improves. So I think that corroborates that data. But I think, the way I would look at it is those psychiatric visits that they have to have before surgery should really be used rather than trying to say as a litmus test whether or not you can get surgery or can't, as rather it should be used as a way to focus on depression, anxiety, and ways to initiate treatment in people who maybe don't have treatment and could use it, but that psychiatric illness should not be a barrier to surgery because really their outcomes are very equivalent to those who don't have bariatric surgery.
That's good news. That's good news. And as somebody that's been in the community for a long time, I'm happy to see that surgeons are actually looking into psychological problems with patients because that seems to be the most, we have to we usually get a psych eval, but we feel that the emotional aspect of weight loss surgery is little understudied, so it's great to see that you actually did a study on this. So we
Oh,
really
thanks.
appreciate it as
Yeah,
patients.
I agree. I think it is an important thing, and I think it's fairly understudied, and there's a lot of investigation that's worthwhile to do.
I think it was a great study, so thank you very much.
Thank you.